Hello everyone, welcome back once again to this channel. This is Grapham Academy. In case it's your first time to tune in, this is Grapham Academy, where we have so many lectures on on different course units. So today we are looking at a course unit called Pharmacy Practice, and the topic that we want to look at more is, or understand more is today, is quality assurance. So we want to know what's quality assurance, how can we practice it in pharmacy practice, how can it be exhibited in pharmacy practice. So that's quality assurance. So we are going to look at the outline of today's class and see what we need to learn, what are the objectives of today. So the objectives that we need to do today or learn today or in the course of the lecture today, we need to define relevant terms. What are the terms that we need to define? And then state the components of quality, those different components that like define quality, and then explain the importance of quality assurance in pharmacy practice. And then we shall look at what are the different principles of quality assurance in pharmacy practice, and then we shall look at the different methods of assessing the level of quality in different workplace, and more specifically, to be more precise, in the pharmacy or a healthcare setting. Then we shall also look at describing the good pharmacy practice as per quality assurance. Okay, so we are starting with our first objective, and that is a definition of relevant terms. So when we are defining terms, we see that these are the different terms that we are going to interact or encounter. One of it is quality. What is quality? Quality is defined as a measure of how good something is. Okay, so that's how you can define quality. When you go to maybe a grocery store, you're going to look at how fresh maybe the fruits are, in case you're buying fruits. So you can define the freshness, and then maybe the appearance of the fruits, and then you can define them, maybe classify them as good quality fruits. Okay, so even in medicine, we see that the service you're going to offer, the drugs that you're going to give to your patient, they have to be of quality. And the service that you render to them, you can also define it or give it with a quality, so that your patients can comply to the treatment. So quality assurance, what is it? We see that quality assurance is a system that gives guidelines which, when followed, ensures that the pharmaceutical preparations compounded and supplied are of quality. So it is a system. It is like an organization in another word, or we can say it is a department in a facility, in a manufacturing unit, in any other place that gives guidelines. Like, it provides the rule, it gives the way things should be done in order. And why does it need to give these ways? To make sure that the product that is going to be manufactured, or the service that you're going to supply or offer, I can call it offer, to the community, to the people that you're offering that service, it's of quality. Okay, so that is quality assurance, a system that gives guidelines which, when followed, ensures that pharmaceutical preparations compounded and supplied are of quite high quality. Because the main purpose of this, we have to make sure that the drugs your patients are receiving, the pharmaceutical preparations your patients are receiving, should be of quality. Because when they're of quality, you're going to reduce maybe adverse drug reactions that can come up as a result of poor quality drugs. You're going to also reduce increased hospitalization. You're going to reduce so many things that come up with poor quality products. Okay, and actually you're saving the life of your patient by making sure that the products are of high quality. So for you to achieve the goal of having high quality products, you need guidelines. You need something to lead you to that step that you're focusing on. Then we see that you can also define quality assurance as doing the right thing the right way and at the right time. When you're doing the right thing the right way in the right time, we are looking at it as a quality assurance. So quality assurance in pharmacy practice, though, refers to measures that you put in place to raise and maintain the standard of work and ensure consistency. Okay, so these are some of the measures that you put. These are some of the guidelines. These are some of the procedures. These are some of things that you put in place to make sure that the standard of work, the service you're offering to people, how you're dispensing your medicine, how they are handled when they reach your facility or when they come to the facility, is of quality. Like there is order, let me call it order. Like there is order, because in the outside world, when they see order in a specific place, they feel that you're offering the best to them. Okay, so when you look at quality assurance in pharmacy practice, what are the things that you have to put in practice to make sure that there is order, there is like people are given the right thing, there is standard being portrayed by people who are offering the service, and there should also be consistency. So we look at what are the components of quality. So components of quality are a number of them. We see that to be able to produce quality products and dispense them in a quality manner, the following components must be followed or must be put in place. One, you need to look at the technical competence. The people you're bringing in, how technical are they? Do they know what they are going to do? Do they know what the purpose you have like brought them in? Do they understand their roles? Are they trained? Are they competent enough to deliver and to make sure that they give out their best so that a high quality product is formed? Then efficiency, there are a number of things that we are going to look at in the coming slides. And then effectiveness, how effective is whatever you're offering? The continuity, like is it continuous or it starts today and stops? If you put in a rule or guideline on how medicines must be dispensed, on the customer service that you need to offer to your clients, does it that like do you start today and then maybe after a week people give up, people get tired of the new system and then give up? Yeah, then you look at the safety, and then you also look at the amenities, and then interpersonal relationships. So we are going to look at them one at a time so that we appreciate them in depth. Okay, so when you look at the technical competence, like I was saying, the personnel working in the pharmacy should have the knowledge, they should be skilled, and they should have the attitude that is necessary to do the good job. Okay, so people should be self-driven to deliver their best, okay, to give the quality that you would be desiring in your company, in your organization. Like you need self-driven and self-motivated type of personnel in your workplace. So he or she should be organized and of good conduct. Yeah, so you find that there are so many attributes of a good and a competent and technical competence. The person should be in position to have good communication skills, and then should have good interpersonal relationship with maybe other clients and also with the patients, okay, with other workmates and the patients. So when we look at efficiency, efficiency involves making the best use of the available resources. When you have your specific resources that you need to put in to make sure that you are preparing a good quality product, you have to make sure that whatever resource that's available, you make the best out of it. Okay, like you may not need to start big, but when you start small, you're able to grow big. Yeah. So when you look at quality assurance, will ensure that the quality of services are provided within the available resources, because the resources that we have are enough for us to offer the quality that is required. Okay, then effectiveness. So we see that with effectiveness, this is how well to accomplish the set objectives. After you have set the guidelines, the objectives to make sure that a product is manufactured and should be of good quality, like how effective are you accomplishing the set objectives? Okay, maybe in the course of the day you set your objectives of the day, and then at the end of the day, are you in position to reflect and see that you achieved or accomplished the set objectives of that day? And if you were not in position to do that, so what was the problem or what went wrong? So even in the manufacturing unit, even in the hospital, there is always need to evaluate like the objectives that we have put across, the new rule that we are inventing in this specific facility. Is it working? Okay. So like people should be in position to do well, do their best in order to accomplish the what? The objectives. That's why in many organizations they have a mission, they have a vision. So you find that every organization works towards achieving their vision, towards maybe accomplishing their mission. Okay. So that's effectiveness. Continuity is when a patient or client receives the complete health services or he or she needs without repetition of diagnosis or treatment. So if a patient comes in or walks in, and then a patient should be handled from different departments without repeating on working on a patient because maybe a colleague doesn't trust the results given by a specific other colleague who was like involved in handling the patient. There should also be continuity, which also keeps or involves keeping the patient or clients well informed about his or her condition, doing follow-up of your patients, and also informing them how they are getting better. You'll see that there is a bit of continuity, like you are continuously providing quality care to your patient. You're continuously making sure that your patient receives the best of what you can offer to them. So that's continuity. In your free time, you can pause this slide so that you're able to understand every point in that slide. And then when we look at safety as another component, we see that this is a requirement which should not be overlooked. All right. So both the service provider and the patient or client needs to be safe. Okay. So whenever you are handling a patient, you have to make sure that you are protecting the safety of the patient as well as yours. For example, maybe you are administering medications using the needle, and then you have to make sure that the patient like you do the right thing, you are injecting in the right part. And then when you're recapping, or of course it's not advisable to recap after you have used it, you should be in position to dispose that, because if you don't dispose it, you're going to forget it, or if you try to recap it, you're going to forget. I mean, you're going to end up pricking yourself. Yeah. So you find that in such a situation, you have not like protected yourself. You underlooked the safety of you as the service provider or as the healthcare provider to these patients. So you have to make sure that your safety and the patient's safety are not taken for granted. Okay, when you're looking at giving the right medications to the patient, I don't overdose the patient. Give the patient what they are required to have. Give the right medication to the right patient, and it should be at the right dosage. When you're manufacturing, there are so many machines that you need to take care of. Like you yourself as a manufacturer, you have to make sure that you are putting on safety gears, and then you are protecting yourself. Also, when you're using those safety gears, you find that all protective gears, you find that you're protecting product from getting cross contamination from you as the person who is maybe manufacturing. And then when you are providing service, we also required to put on like protective gears, like you have your clinical coat on for those who put on clinical coats, or a uniform for the nurses. That is in our country here. I don't know about other countries how they do it. So safety comes in first. You need to avoid spillage of content or different drugs, okay, be it syrups, be it maybe blood transfusion. Like you have to make sure that you're protecting yourself and the patient's self. So the next component that we need to look at is amenities. So amenities refers to the features of health services that do not directly relate to clinical effectiveness that may enhance patient or client satisfaction and willingness to return to the facility. Okay, so these specific amenities is like when patients maybe come in, how are they welcomed? And then after they come in, like maybe they are waiting to be attended to, is there something that is given to the patient? Okay, the health education, either maybe they are given television, or if it is children's ward, there are some cartoons, like some maybe toys that the kids can play with. So those are like other amenities that you are providing, not necessarily you find that they are not directly to the health facility or clinical related, but you find that this enables to enhance patient satisfaction. The patient should be in position to trust not only you as a person who is providing the service, but also should be in position to trust the facility. Okay, because most patients can come in and then they are complaining of the facility, not necessarily the people who are there, but maybe the environment, maybe like atmosphere. So many things can really affect patient satisfaction. So amenities are those other things that you are going to do as a healthcare provider. What is it? What extra thing are you thinking of as the patients are waiting to be attended to? What can we give the patients? Some facilities actually give patients breakfast, lunch, and the rest. For facilities that cannot afford, patients are given entertainment like maybe television, where in television they are talking about health related topics, okay, encouraging them maybe on sanitation and so many other basic things. And you find some of these will enable patients to like build trust, and yeah, they may look small things but can build trust, eh? Yeah. So what are the importance of quality assurance in pharmacy practice? So by now, I believe you should be in position to outline or at least have an understanding. If we are doing all these things, how would it benefit the community? How is it of any relevance anyway? Okay. So quality assurance is a system that sets guidelines like we were saying in the first slide, which when followed ensures that the end product dispensed are consistently of high quality. So you find that quality assurance is important in pharmacy practice for the production of effective and safe medicines and services that you're providing to the patients. And you will have so many other advantages. Maybe you can share them in the comment section, and then I can be in position to know that you have understood what we have been talking about and you are together with me. Yeah. So what are the principles of quality assurance? We are going to something else. We have left advantages. Of course, there are a number of them, but I'm trying to give you like a room to think about them and then share in the comment sections for me to be sure that we are together and we're moving together. Yeah. So what are the principles of quality assurance? So we have seen that the goal of quality assurance in pharmacy practice is for the health professional to give the best healthcare services to the patient and client. So in case of pharmacy professionals, you find that therefore we should produce quality products and dispense them correctly for the benefit of our patients or our clients. Okay, so this aspect of ensuring that quality are called like principles of quality assurance. So there are basically 5 principles of quality assurance. The first of them is meeting the patient client needs. We are looking at meeting the needs of the patient. The second one is we are focusing on the processes of healthcare delivery. How are we delivering our services to the patient? Is it benefiting the patients anyway? Then we look at what is the use of data to analyze. How can we use data to analyze the service delivery that we are delivering to the patients? And then we need to also look at the aspect of teamwork in improving the quality. Okay, that's why in most facility there is specialization. You find that there is a person who is in charge of maybe taking history of the patient. There is a person in the lab. There is a person in the pharmacy. So there is like an aspect of teamwork. And when we work as a team, you find that we improve the quality of service that we are offering irrespective of the organization. It may not be a medical related organization, but you find that teamwork really brings or improves the quality. Okay, then use of good communication skills. You need to communicate. Okay, so we are tackling them one at a time, like we're saying, meeting patient client needs. This is a bit self-explanatory. We see that the patients, what they need or their needs is treatment of their illness. They want to get better and go back home. Okay, and then immunization. There are specific diseases that we do immunization. A patient requires to get that, and then control of epidemics in case of any epidemic. So before even these come up, we need to control them. That's why we need to always have public health related activities. And then change in behavior towards more healthy practices. This is like what your patient needs. So you need to be in position to prepare quality products for the need of the patient. You should be in position to store these products in the proper manner so that the patients get when the quality has not degraded. And then you should be in position to dispense these products in a manner that ensures that the quality of the product is still intact. Okay. So this is like example for those facilities that are in charge or also have to prepare, okay, carry out preparation. So we see that it is commonly referred to the manufacture or compounding. They call it extemporaneous preparation in the facility. So you find that in our country we have so many few facilities that do this compounding in the facility. Okay, so there are others, maybe other countries maybe be having so many hospitals that are doing this compounding. So in case a prescription is brought to you and then you are required to reduce a specific strength of the drug to accommodate that other patient whose maybe grams are not there in the facility. You need to be in position to make sure that all the procedures you're going to use, you are maintaining the hygiene, you are maintaining that the product you're going to bring is of quality, you're going to minimize adulterations, you're going to follow instructions of what you are required to prepare so that you are protecting the health of your patient. In your free time, you can pause this slide and then go through it. Okay. So this still goes after you have manufactured it. How are you storing it? What do you need to do when you're storing? What are the things you need to consider when you're storing? Are you following the standards of storage? Are you following the standard of storage of raw materials? Not only the product that you've made, are you looking at the dangers of maybe temperature affecting your product under storage, maybe those other humidity affecting your product under storage. If it is a cold chain compound, are you putting it at a regulated temperature or you're putting it at room temperature? Okay, so all those things you find that you are ensuring quality. Then when you're dispensing it, how are you dispensing it? How are you packing it? The packaging material you're using, is it going to interact with the active ingredient that you have put in your product? Okay, and then you have to look at the compatibility of your drug with the packaging material. And then how are you giving instructions to the patient? Are you giving the patient enough information? Are you telling the patient instructions of how they should swallow the medicine, how they should take the medication? What are the side effects that they may come or arise as a result of taking this medication? Like a patient needs to know all this information because some of them are going to get these side effects and then they stop taking the medication and they feel like the medication is not working for them. And yet, those are expected outcomes from that specific medication. So, when a patient stops taking medication, you find that that's another case because you're going to treat like two things at the same time because the first condition is there and then maybe the condition has increased, so you find that it gets hard. So focus on the process of healthcare delivery. So you see that according to research, areas of quality assurance have shown that at least 80% of the problems in providing health service is related to the weak steps in the process. Okay. And not more than 15% are the fault of the persons working the system. You find that written procedures for every service we provide in the pharmacy or as pharmacy professionals. For example, the production of pharmaceuticals and dispensing of medication must be followed, okay? And they have to be written. So we call these standard operating procedures. If we are manufacturing, we shall call them the good manufacturing what? Practices. So about focus, we are still continuing with the focus on the process of healthcare delivery, which takes us to what I was talking about, that's good manufacturing practices. And I request if we can handle this in the next lecture so that we can expound and appreciate what good manufacturing practices are. So I want to say thank you for listening. If you came this far listening to this specific lecture, kindly put it in the comment section so that in the next lecture we shall send a greeting to you and appreciate you so much for tuning in. So thank you so much. Stay tuned to Grapham Academy. Like, subscribe, and yeah, hit that bell so that you always get notifications whenever we upload a new video. I wish you all the best.